All right. Hi, my name is Sarah Krishnisnik, and I'm the student pharmacist. Before we start, can I get your name and date of birth?
Yeah, it's Benjamin Sharp, and my date of birth is January 13th, 1949.
All right. So it sounds like you're in today because your granddaughter is 30 weeks pregnant and wants you to get up to date on all your vaccinations before you meet your new um, grandchild. It sounds like you aren't sure why she is so adamant about it. Does that sound right?
Yeah, that's exactly right.
Okay, perfect. Before we get started, let's go over a little bit about you. It looks like you're 75 years old and you haven't received any vaccines in the past 20 years. It also looks like you have a history of hypertension, gout, and osteoarthritis, and you have no known drug allergies. You're not currently on any medications that would suppress your immune system. Has your doctor ever told you that you have any medical conditions that might suppress your immune system?
Nope, I just have the high blood pressure, gout, and arthritis.
Okay, perfect. So based on your age and vaccine records, there are 6 vaccines that I would recommend you get today. These are all recommended based off of the Advisory Committee on Immunization Practices. So the first one is Tdap. Since you haven't received a Tdap vaccine in at least the last 20 years, and because your granddaughter is having a baby, I recommend that you receive the Tdap vaccine today. The Tdap vaccine protects against tetanus, diphtheria, and pertussis. The pertussis component of this vaccine is especially important as your granddaughter is having a baby. Babies are unable to receive vaccination against diphtheria, pertussis, and tetanus until the age of 2 months and do not complete their childhood series until 4 to 6 years of age. This is especially important because children under the age of 12 months have substantially higher rates of pertussis illness, complications, hospitalization, and death, with the highest incidence under 2 months. Efficacy of the Tdap vaccine against tetanus, diphtheria, and pertussis is high, although not 100%. No laboratory values have been identified to explicitly establish the efficacy of the Tdap vaccine, although the CDC reports that efficacy of this vaccine is roughly 79 to 89%. Efficacy from each component of this vaccine is not lifelong. The pertussis component starts to be reduced after about 2 to 4 years following vaccination, and then the diphtheria and the tetanus component last for roughly 10 years. Benefits of receiving the Tdap vaccine include protecting young children around you from tetanus, diphtheria, and pertussis. It can also help prevent you from becoming sick with tetanus, diphtheria, or pertussis. There are 2 Tdap vaccines in the US. They are called Boostrix and Adacel. Although both can be used in patients 65 years of age or older, Boostrix is the preferred option by ACIP. It is a single-dose vaccine. 0.5 mils of the vaccine will be administered into the muscle of your upper arm, and routine vaccination should occur roughly every 10 years. Although, because that pertussis component does reduce roughly 2 to 4 years after vaccination, if your granddaughter or other family members continue to have children, it may be appropriate for you to receive an additional dose sooner than 10 years.
And because you are over the age of 65 and you have not yet received a pneumococcal vaccine, the CDC does recommend that you receive a conjugated pneumococcal vaccine for the best possible coverage. Those options would be the Vaxneuvance, Prevnar 20, or Prevnar 21. The Vaxneuvance would require a second vaccination in 1 year to get full coverage, while the Prevnar 20 and the Prevnar 21 would just be 1 vaccination today. The Prevnar 21 covers 21 different serotypes, so just kind of types of the bacteria, and the 20 covers 20. So I would recommend that we get the Prevnar because that will cover those 21 serotypes, cover about 84% of the invasive pneumococcal diseases that can happen. This vaccine protects against illnesses caused by pneumococcal bacteria, such as lung infections, including pneumonia, ear infections, sinus infections, meningitis, and blood infections. The Prevnar 21 has shown to be up to 85% effective in preventing these diseases. It provides protection for yourself and also for those around you to prevent you from carrying and transmitting that disease to them, including your new great-granddaughter who can't herself get vaccinated. It is an intramuscular injection. It contains, like I said, 21 different serotypes, and it's a 0.5 ml injection. It is just one vaccine for today, and that will be your full coverage.
I would recommend the high-dose flu vaccine because the high-dose flu vaccine protects against seasonal influenza, and the high-dose vaccines are recommended over 65 years and older. The exact duration of immunity can vary depending on the person, but usually it is effective for 6 months. Typically, flu vaccines are effective 40 to 60%, but high-dose flu are 20% more effective in preventing flu than standard in over 65 years old. Based on the guideline, the high-dose vaccines is the most evidence available, and our pharmacists carry on high-dose vaccines over 65. These high-dose vaccines contains 4 times the antigen compared to standard, which generates significantly better antibody response. It helps your body to protect against influenza. Also, this vaccine can prevent complications like pneumonia and hospitalization, particularly in adults aged over 65. It is just one dose, 0.7 ml, and administered intramuscularly, and it is administered once per year and ideally in September to October.
So since you have never been vaccinated against COVID-19, I would recommend you get a COVID-19 vaccine today as well. It will protect you against SARS-CoV-2, which is the virus that's responsible for COVID-19. Unvaccinated people are at a higher risk of severe disease and more of the long-term complications. Based on the ACIP recommendations, this vaccine is recommended in anyone that's 6 months and older. It will provide great protection from infection for up to 3 months and will protect you against severe COVID and hospitalization for up to 6 months. Vaccinated people have more than 50% increased protection against ED, urgent care visits, and hospitalizations compared to those who are unvaccinated. And then vaccinated people also have around 54% more protection against the signs and symptoms of COVID compared to those that aren't vaccinated. So the benefits of this vaccine, it's going to protect you against severe COVID infection, hospitalization, death, and it's going to reduce the risk of long COVID. It's safe to get this vaccine in combination with the other ones that we've recommended so far because it's an inactivated vaccine, which means that there's no replicating virus involved. There are a couple of different options. So the Novavax is going to be a 2-dose series, and the Pfizer or Moderna vaccine would both be 1 dose. Since the Moderna is only 1 dose and it's the main one that we carry, I would recommend it. It's going to be 50 micrograms per half ml, and it's going to be injected into your upper shoulder muscle.
I would also recommend the RSV vaccine. The RSV vaccine protects against RSV infection. RSV is a respiratory virus that can be dangerous and cause illness and hospitalization in children and older adults. This vaccine is recommended for anyone 75 years or older and will provide protection for at least 2 years. This vaccine will be especially beneficial to you since your granddaughter is pregnant. RSV can be especially dangerous to newborns, so you can help protect them by getting vaccinated yourself. This vaccine is about 80% effective in preventing RSV-associated emergency department encounters and RSV-associated hospitalizations. There are a couple different RSV vaccination options available, but Arexvy would be a good option since we carry that vaccine and you only need to get 1 0.5 milliliter dose today to receive the benefit.
I would also recommend getting the shingles vaccine, which provides immunity against the herpes zoster virus, which is basically just a reactivation of the virus that causes chickenpox. Shingles can be a very uncomfortable disease to have, and most adults will get it if they haven't received the vaccine. This vaccine is recommended for all patients 50 years and older, and it's 90% effective at preventing the shingles infection. Even after 10 years, it still has an 87% effectiveness at preventing the shingles infection. Shingrix is currently the only available vaccine in the United States for prevention of shingles, and it is a 2-dose series. I recommend receiving the first dose today, and then the second dose will be in 2 to 6 months. It is just a 0.5 ml injection, and it will be administered into the deltoid muscle on the arm. And then most people tolerate these vaccines well, but you may experience some injection site pain, swelling, or redness. You may also experience some fatigue, body aches, headache, or fever. And then I know that was a lot of information. What kind of questions did you have?
That seems like a lot of vaccines. Where are you gonna give all of them?
Yeah, that's a good question. Since we are recommending 6 vaccines today, we would just recommend giving you 3 in each arm. Is that all right with you?
Yeah, that sounds good. What can I do if my arm hurts, since that's a lot of vaccines?
Yeah, there's a lot of vaccines, and you will probably expect some soreness in that area. I would recommend taking maybe some over-the-counter ibuprofen or some Tylenol just to kind of subside that pain.
Will I get any of these infections from the vaccines themselves?
No, these vaccines won't cause any of those infections. They're all inactivated vaccines, so there's actually no live pathogens involved in them.
Okay, I think that's all the questions I have.
Perfect. And then did you want to go ahead and proceed with all these vaccines today?
Sure, let's go ahead and do all of them.
Perfect. And then are you okay after we give the vaccines? Are you okay to wait around for about 15 minutes just to make sure you're not having any allergic reactions to any of the vaccines?
Yeah, I can do that.
Perfect. We will go get them prepared.